Now, next is the principles of health education. As we know, health education it is not a thing which can be given to one person by another person. Now, if we want to give health education messages to a community, we have to understand certain principles which should be followed with the health education messages. Now, number one principle is the credibility. No, the health educator or the communicator who's giving those messages, he should be trustworthy, and the people of the community should have proper confidence in that person. Now, if the people of a community, they don't trust that communicator, the desired action which we are planning to have through that message is not achieved. So credibility of the communicator is very important, or credibility of the health education message is also very important. Now, if you are giving scientifically proven knowledge to the people, only then they are going to accept that thing. So credibility of the communicator as well as the health education message is very important. Next is the interest. Now, whatever message the health educator is giving to the community, he should know before giving that message that what is the felt need of that community. Now, if he is going to talk about the felt need, then only he can get the people interested in perceiving that message. If he's not going to give the message according to the interest of the people, that health education will be message will be wasted. So whatever health education message should be given to a particular community, it should be according to the felt need of that community. Now, next is participation. As you know, in Alma Ata Declaration, primary healthcare healthcare was started with the principle of community involvement and community participation. So, participation of the community is very important during health message. Which is given to the community. Now, health education, it should aim at encouraging the people so that they work actively with the health workers and others in the community, so that they are able to identify their own health problems, and so they can make plans to work them out. So participation of the community is very important. Next is motivation. Now, in every person, as we all know, there are desire to learn new things. Now, that awakening of desire is called motivation. Now, motivation can be primary, that is inborn, or it can be secondary. Now, inborn motivation is the basically the driving forces which initiate to people to act from within. And the secondary motives are based on desires which are created from the outside forces or by incentives. Like if you want to tell obese community or a group of people that they should reduce weight, you should give an incentive to them. Like if you are going to tell them that it is going to affect their cardiovascular system and all, any they will get any disease, so that is not an incentive. Now if you are giving health education to an obese person or a female, you can also tell her that if you lose weight, you are going to good look. So that is a secondary incentive which you are giving to that female. So motivation in health education is very important. Now, next principle in health education is comprehension. Now, before giving a health education message, the health educator or the communicator must know the level of understanding, education, and literacy rate of the people of the community. Now, according to that, he should comprehend his message. Now, if you are telling the people of the community that if you have diabetes you should eliminate starchy foods. Now they may not know what are starchy foods, so you should talk in the language which they know, and you should try to tell them according to their mental levels. So comprehension is very important. Next is reinforcement. Now people they learn more by repetition and at different intervals. So by reinforcement of things you can get good results. Next is learning by doing. Now there is a Chinese proverb which says, "If I hear, I forget. If I see, I remember. If I do, I know." By just by this proverb, it illustrates that the importance of learning is by doing things. So you have to tell the people so that if they want to learn something, they should adopt it and they should do it. So this is a basic principle of health education. Next is known to unknown. Before giving a health education message, I told you before, you should know the level of understanding, level of knowledge and education and literacy rate of that community. So according to that which is known to the people of the community, then you take them to unknown level. Now if you start from very complicated things which even the people of the community don't know any simple thing regarding that particular problem, so they are not going to understand it properly. So you should go what according to the things they know, and then you should proceed to the difficult level. And this is how you can give a proper and positive health education messages to the community. Now, next is setting up of an example. Now, if the suppose an health educator is giving them a health education message regarding the hazards of smoking, he should also not be a smoker. Now, if he's telling them about hazards of smoking and if he's smoking himself, then he's not setting up a good example, and then that health education message will not be perceived properly. Next principle of health education is good human relationship. Now, whatever the communicator or the health educator is giving message to the community, he should have good communication skills and he should have the art of having good human relationship with the audience or the other persons. So, a good human relationship is also very important. Next feedback is next sorry topic or the principle is your feedback. Now feedback is one of the important key concepts of the systems approach. Now the health educator can modify the elements of the system. For example, he can modify his message, he can modify his channel in the light of feedback which is being given from the audience. So feedback is also very important. Now next principle of health education is leaders. Now usually whenever we want to give health education message to a community, the health educator tries to penetrate that community through the leaders. On the leaders, usually people have trust and they listen to them more. So the health educators they usually proceed in a community with the help of leaders, as their credibility is more. So these are the basic principles of health education. This is an important SEQ question. So you should know all these 12 principles of health education as they are very important. Now, to practice health education, you need certain audio visual aids as well. Like you can use tape recorders or microphones or amplifiers, or you can use some visual aids like chalkboards or your leaflets, posters in the form of charts, or even in the form of PowerPoint slides, or any models or specimens, or you can combine both auditory and visual aids to give health education message to a community. Now, there are different methods in communicating health education messages. Now, these health communication approaches can be at the individual level, like you can give health education at the to the other person on one-to-one basis, and this is quite effective as compared to the other methods, because you are taking individual care of the other person, and you are telling them what their felt need is, and you are talking according to that. Or other methods are through group approach. Now, in group approach, usually there are different groups in a society. They can be group of school children, or they can be a group of mothers, or they can be a group of patients or doctors. So there are you can give health education messages to different groups. Usually it's easy to give health education message to a particular group, because all that people in that group have similar interest and similar knowledge. So by group approach you can use different methods. Yeah, like you can give different lectures which can help to in giving the health education message to the group, or you can give in the form of demonstrations, like in certain things, like if you are telling the community how to prepare ORS solution, instead of just telling them, you can demonstrate that well as well. So that is more effective as if you combine both the things. Or you can have group discussion methods. Now, in group discussions you can have panel discussions. Like in panel discussions, usually there is a panel of 7 to 8 doctors or people who are qualified enough to talk about a certain topic on whom you require to give health education, and there are an audience in front of it. And the panel, usually it comprises of a chairman, a moderator, and 4 to 8 or even more or less speakers. So the panel discussion is carried out, and it's on and at the end the audience can also participate. Now, the group discussion can be in the form of a symposium. Now, in a symposium, there is a series of speeches on a selected topic, and each person or the expert, it present an aspect of the subject briefly, and there is usually no discussion among the symposium members like in a panel discussion, and in the end the audience may ask questions. Now, next type of group approach is by conducting certain workshops. In certain workshops, you can also give health education messages to the community, or you can conduct conferences and seminars as well. Now, other method that can be used in communicating the health education message to the community is by mass approach. Nowadays, as you know, TV is the most popular of all the media, and so is internet. So through them you can educate a community or a group of people that how they can take care of themselves, or whatever message you want to convey them. So you can use different materials as well, like newspapers, or a printed material in the form of pamphlets, or in the form of booklets, or even in magazines. Now, the health education messages can also be displayed on billboards or signboards and on posters as well. So, these are the different methods which can be used in communicating with the community whom you want to impart the health education messages. Our next and the last topic is the stages in adoption of new ideas and practices. Now, as I told you before, that in health education you start from a stage of known to unknown. Usually, the community whom you are delivering a health education message about a certain topic, they are usually not aware of that thing. So, you start what they know about it, and then you proceed to the unknown. Now with that, then only you are going to increase their awareness, and then they can develop interest. Now when they develop interest, they are going to evaluate that thing and see all the benefits and disadvantages of that thing, and if they think they are beneficial for them, then only they are going to adopt that thing, and this can bring about a positive behavioral and change in them. Now, with this, we finish communication and health education. Now, if you have any queries or any questions regarding this topic, you are most welcome to ask. Now, in the end, I'm going to give you an assignment that every student at the individual level have to design a poster regarding the health awareness of coronavirus. Now this poster will be given some marks in your internal assessment. So you have to send that assignment by Friday 12 o'clock, and after that no assignments will be taken. Thank you so much.